Good day, everybody. My name is Untitled. I'm one of the psychologists at Stabilis Treatment Centre. I've been working at Stabilis Treatment Centre for the past 21 years. Through these 21 years, I've gathered information, not specifically from books, but rather from the experience of the patients that we treat here, as well as relapses that we see. In other words, people coming back for treatment. Therefore, today I'd like to discuss the importance of setting realistic expectations in recovery. When you set realistic expectations, it helps you to stay on track. Realistic expectations goes beyond just avoiding a relapse. It is important to keep in mind when you do set these expectations to stay on track and to know what is expected of you. I'm going to mention a couple of things to bear in mind when you set these expectations. Firstly, very important, you need to mentally prepare yourself for the process. You have got to understand that the process will involve difficulty. It will involve you being taken out of your comfort zone. And when you have a clear understanding of what the process involves, it will become less difficult for you and you will know what to prepare yourself for. Secondly, very important, try and avoid nasty surprises. By staying realistic, you'll avoid uncomfortable surprises. If you think recovery will be easy by just showing up, you're making a huge mistake. Stay realistic so that you don't get knocked off your feet by surprises. Thirdly, stress reduction. If you set realistic expectations and expectations that is possible to meet, you will feel less stress, which will make it easier for you to achieve your goals. In this regard, I often recommend to my patients that the worst thing that you can possibly do is to make a promise to your family. So that is setting expectations with them. Nobody can ever promise that they will be able to maintain sobriety. That is just completely impossible. However, I have seen myself through family sessions that a lot of times these family members are so desperate for some kind of peace of mind that they would literally put you into a corner and ask you to make that promise. That is not setting a realistic expectation for your family. Be careful of making unrealistic promises and unrealistic expectations. It is not going to reduce your stress, it will just add to your stress. Fourthly, have patience. It's very important to know that this process is going to be taking a lot of your time, a lot of your commitment. If you have unrealistic expectations, you may feel impatient towards achieving your goals. By setting realistic expectations, you are better able to remain patient and stay on course. Fifth point to make in this regard is to monitor your progress every now and then. And it's quite important to do this probably on a weekly basis. If your expectations are too high, you'll have a misconcept of your actual progress and it may leave you feeling that you're failing. Without realistic expectations, you may be not in the position to realize that you are actually on track. In this regard, I think your support group meetings, your follow-up sessions with your therapist is a brilliant way to monitor that progress. Because sometimes when we are actively trying to achieve something and we don't have the ability to look from outside in terms of what we are doing, we need somebody else that is an observer in terms of the progress that you have made to give you that feedback. So it's important to find somebody, whether it's your therapist, whether it's your support group, whether it's a family member, to help you to monitor your progress. There's also 3 important things that I'd like to mention that you need to consider when you are setting your realistic expectations. Firstly, remember that recovery is a process. This is where the patience part comes in again. You can't have the belief system that when I go for rehabilitation, which will be 3 weeks or 4 weeks, that after that treatment I can close the book and everything will be past. Your recovery is a process, and that process will be part of your life going forward, and it will be part of the decisions you make. It will be part of the joy that you will hopefully experience going forward. Secondly, very important to educate yourself on the treatment process. Know what to expect, know what it's about, so that you don't walk into the treatment process and you are unsure of what to expect. Lastly, learn about addiction. The more you know, the more insight you develop into the problem, the more it's going to enable you to understand what you are dealing with. And at the end of the day, that will also allow you to set those realistic expectations. Thank you for listening, and I hope that these tips will help you in setting those realistic expectations and to continue with your process of recovery. Good luck. Goodbye.